Nikki.
Hi, Nikki.
We're sitting here on the brain stage in the bone center while Riley's working. So, extra credit for us.
True.
So this is our cranial nerve assignment. We hope you enjoy. So cranial nerve number 1 is going to be olfactory. Off to a great start. Olfactory is going to be a sensory nerve. How you would test olfactory is just by testing their smell. So I would have Riley close your eyes. And then I would hold this up to Riley's nose. Riley, do you smell anything?
I do.
What are you smelling, Riley?
Lemon, like hand sanitizer.
Oh, Riley's sense of smell is working, ladies and gentlemen. Alrighty. So we would say that Riley's olfactory cranial nerve is functioning properly. If it were not functioning properly, he wouldn't have smelled anything. He might have smelled something not hand sanitizer, which is pretty crazy. So moving on, cranial nerve number 2 is going to be optic. Optic is also a sensory nerve. How you would test optic is just basically having him read 2 things. One thing's going to be near, one thing's going to be far. So what I could do is ask Riley, hey Riley, can you read my sweatshirt? What does that say?
Nike.
Cool. So that would test the near. Test the far. In the auditorium, it's kind of hard to find stuff. Okay, Riley, there's a sign over there with white, it's a white sign, red writing. Can you tell me what that says?
No smoking.
Fantastic. Alrighty. So he was able to read near and far. If that were malfunctioning, he wouldn't have been able to do that. Might have been a little fuzzy. Might have gotten the words mixed up. But since he was able to, that is a good sign. Moving on to number 3. Number 3 is oculomotor. Number 3 is a motor nerve. How you test oculomotor is going to be raising his eyelids, having him retract or see if he can kind of just react to light, and then he should be able to adduct his eyes, make them go in. So make sure that I don't press the camera, I press the light. So Riley, do me a favor, make your eyes big as they can for me. Perfect. That you can raise your eyelids, that's good. All right, so just look straight at me, try not to blink. I'm gonna hold light here. Make sure that we get a constriction and a dilation. I'm gonna do that to both eyes, test both sides of the brain. Cool. He was able to constrict and dilate, so that is also a good sign. Now, what I want you to do is look straight at this pin. Actually, yeah, look straight at this pin. I'm going to test the right eye first. Go straight in. Perfect. Straight inward. Perfect. So he was able to adduct his eyes towards his nose. We didn't go up or down. That's testing some other cranial nerves. So that basically just means that his cranial nerve 3 is functioning properly. Anything were to go wrong, it would be the opposite. Cranial nerve number
is cranial nerve number 4, which is trochlear. Trochlear is going to be a motor nerve. Good way to test trochlear is by thinking of the cute shoes terminology. So I'm going to hold a pin out here. I'm going to move it towards his nose slowly, watching for any sort of movement in his eyes. And he was able to perform that pretty well. So that is how you can tell if trochlear is working. If he were to not follow all the way down with your pen, then he probably has an issue with cranial nerve number 4. Cranial nerve number 5 is going to be trigeminal. Trigeminal is actually going to be both nerves, so it's going to be sensory and motor. The sensory is going to be facial sensation, while the motor is going to be moving his mandible. So, Riley.
Yeah.
Do you feel this?
Mm-hmm.
Do you feel that?
Mm-hmm.
That's what it should feel like. Now, you let me know which side of the face I am touching.
Left side. Right side. Top.
Cool. So he was able to differentiate between the sides of the face with his eyes closed while I was touching him, so that is a good indication that the sensory nerve of the trigeminal is functioning properly. The motor is going to be moving the mandible, like I was saying. So, Riley, can you move your mandible, your chin, your...
Mm-hmm.
I don't know what you would say to somebody who isn't. Can you move the bottom of your mouth side to side? Can you move your jaw up and down, back and forth? Cool. So he was able to do that very fluently. There was no hesitation. There was no functional abnormalities as he did it from side to side, up and down. So his motor functioning of his cranial nerve 5 trigeminal is working properly. I thought you were going to sneeze. That would have been good for the camera. Cranial nerve number 6 is going to be abducens. Abducens is going back to the eyes. It is eye abduction. So another way to do this is just like doing it when you're testing adduction, except you're paying attention to the opposite eye movement, obviously. We're going to have the pin out here, and again, we're going to go slowly from side to side, slowly focusing to make sure that he is moving both eyes back and forth. He's not moving his head. There's no stagnus of any sort, which he doesn't have any, so cranial nerve number 6 is functioning properly. If it were not, he would have shakiness in his eyes. If that wasn't normal for him already, he wouldn't be able to follow. His eyes might get sidetracked, might just not have any movement at all. Going down to cranial nerve number 7, which is going to be facial. Facial is going to be both as well. The sensory is going to be taste. The motor is going to be facial expression. So we don't have anything, but let's just say that we have something sour like a sweet tart. I would hand Riley a sweet tart. Taste it.
Mm-hmm.
How's it taste?
Sour.
And you can see he had the facial expression too. So that's basically knocking out both. If he stuck something sour in his mouth and he just eats it, doesn't have any sort of just like kind of facial expression, then we'd start to get worried, especially if that wasn't normal for him. Moving on to cranial nerve number 8. That's going to be vestibulocochlear. Vestibulocochlear is going to be sensory, basically just hearing and balance. So I would have Riley close his eyes. Riley, this is what I want you to listen for. It's like Killer Queen. It's a good song. So, you scoot over this way just a tear. All right, close your eyes. Remember that snap. What side am I on?
Both.
Oh, that was good. So that knocks out the hearing version of that. Now we want to test his balance. Riley, can you stand up for me? Good way to do this is just with a standardized best test. Riley, can you stand double leg? Yeah, Riley, that's tandem. Single leg. Now tandem. Cool. So anytime that somebody could be suspected of having something like a concussion or something, you're always going to want to have a standardized baseline test, such as like a SCAT-5, so that you know what their norm is when they're not concussed, of how many errors they had during each of those, whether it's double leg, single leg, tandem, and then compare. That's the best real way to test the balance aspect of that. Moving on to, or I should say, if they have any more than their baseline, like an abnormal amount, then I would suspect that cranial nerve 8 would be in some sort of way malfunction, at least on the balance standpoint. Cranial nerve number 9 is going to be glossopharyngeal. This is going to be both as well. Sorry, not as well. The last one was sensory. So this one's going to be both. The sensory portion of this is going to be taste. The motor version of this is going to be the ability to swallow. So going back to that sweet tart example, I would hand him the sweet tart. He would tell me what it tastes like.
Sour.
Did you swallow that?
Mm-hmm.
I trust him. But you'd obviously look in their mouth, make sure they were swallowing. I would go as far as watching their throat, making sure that there's no sort of abnormal sights, if you could say. Just make sure that you do see movement going down, making sure that it leaves their mouth, basically. If they're not able to do that and they're not able to get that swallowing sensation or function, then that cranial nerve is definitely messed up. But that tests sensory and motor for glossopharyngeal. Cranial nerve X, or 10, is going to, DAs, is going to be vagus. Vagus is going to be both. It's going to be the one that we don't really care for that much because it sucks. It is gag reflex and speech. So, Riley, open up. And then I would use something as along the lines of like a tongue depressor and just, and I'm not going to do it on Riley because he's my friend. Riley, repeat after me. I like crepes.
I like crepes.
Cool. So that tests both sensory and motor. The fact that he's able to talk, he's able to process, processing really isn't this cranial nerve, but he's able to use his speech. That's really what we're focused on with cranial nerve 10. Anything abnormal from what we were just talking about is going to be a malfunction, and we'd be worried about that. Cranial nerve 11, accessory, which requires accessory of me getting up. Cranial nerve, oh, sorry.
No, you're right.
No, I'm talking to Nikki. She can't see me. Okay, so cranial nerve 11 is accessory. It is a motor nerve. Basically, how we're going to test this, I'm going to resist his shoulders. He's going to try to shrug against my resistance. I'm not applying that much resistance, but the fact that he is able to use his muscles to go up means that nerve's working, that cranial nerve's working, the motor aspect. So that's what we want to see from that. If he's not able to do it, he's a big, strong weightlifter, so he should be able to do that. If he wasn't, I'd be worried. Finally, Ms. Hoffman, Professor Hoffman, Nikki, cranial nerve 12. Cranial nerve 12 is going to be hypoglossal. That's going to be the tongue movement. It is motor. It is a motor nerve. So I would ask Riley to stick your tongue out in a nice way. This is our professor still. Move it side to side, up and down. All right, I'm watching him in the camera. So I would make sure that there's no, that he's able to do it. If he's not able to move it to one side, if he has like just abnormal tongue movements, I would start getting worried. No movement at all. One side is kind of moving up and down. One side's kind of just paralyzed. I'd be worried. Basically, anything about the tongue, as long as it's normal, we're happy. That's pretty much it. After you test all of those, all the cranial nerves are in check.
Good to
You're
go.
pretty good at that point. Thank you for listening to our presentation. We greatly appreciate it.
Thanks, Nikki.
Grade nicely.